should be live in just a second.
10-4. I've got it ready to pull up.
Mother. Why am I having to log into everything all of a sudden? God damn it. Okay.
It's noise. Sign in and everything.
All right.
Looking good, bud?
Almost. Almost ready.
See if are we rolling in on the tube?
Yeah, we should be.
10-4. Here we go. Matthew, welcome.
All right. I think I'm ready. What do you think?
I like it.
Okay. Stacey, you had some topics? It's
Yeah.
topic time.
Just a couple. gonna sound like I have a sock in my mouth, but I guess that's okay.
Oh yeah, we could talk about that.
Sounds like Emily in Paris music.
Kind of. That's your theme music for Topic Time, Chase. Okay, I'm ready.
Okay.
Let's do it.
Sirius XM. It's time for Weird Medicine with Dr. Steve.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the wacko alternative medicine asshats. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey. How are
Hello.
you? All right, very good. This is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347.
Pooh head.
Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, and don't forget to check out Dr. Scott's website at simplyherbals.net. That's Simply Herbals. Oh, what did you bring? What did
I
you
brought
bring?
you
What is
something
that?
good.
Oh, what is this?
That's the
me see.
CBD nasal spray.
Oh, now we're not. This is not an advertisement.
No.
We
It's
can't-
just a gift for you.
Oh, thank you, my friend. Thank
good,
you.
Good
Yeah.
for you.
I'm very excited. Now, this looks like it's got the new and improved sprayer, too. Am
Yep.
I correct?
Yep.
Oh, yeah? Okay, I'm going to do some right
Special
now.
order for Dr. Steve.
Yeah, so tell us what's in this stuff.
So peppermint oil, little
Yes.
vasodilator.
So the peppermint oil is for,
Well, it's
you don't want a vasodilator. You mean a vasoconstrictor.
Vasoconstrictor.
He's all nervous.
I'm
Oh,
nervous.
yeah.
But it's got
Oh, this is 1,000 times better.
it's got a nice little bit of CBD.
Oh, and it's
oil
got
there.
an earthy, CBD kind of cannabis-y sort of smell. Not that I would know.
No, sir.
Taste, you want to try it? No, I'm just kidding.
I'm
Shoved
good,
it up
thank
my
you.
nose.
Good for you.
That is, now you've really done it, my
Now
friend.
we're into some things.
So you have buffered saline
Yep. Little honey,
and honey,
a little bit of salt. Yeah.
sodium, sodium chloride, right?
Yes, sir.
In just a little bit. Oh, we'll just put a little bit in. Well,
pinch
you
of
haven't
this.
measured out properly, right?
No, of course not. Of course not.
And then just dump
You
some
know me better
CBD
than
and a little meth and
As
some
Miles,
fentanyl in there,
Miles
and it'll be
Davis would
perfect.
say, the bitches brew as
Yeah,
well.
there you
The
go.
bitches brew.
I used to do when I was in, I got my undergraduate in television production or radio, television, motion pictures, University of North Carolina, Chapel Hill, and I used to call it the Miles Davis technique. And if I ever made a mistake, I'd just say I meant to do it that way. That's what we always said. Miles did something,
Right on.
sometimes.
There's no
Miles
such
was
thing
amazing.
there's no such thing as a wrong note, right?
That's right. That's right. Correct. There's no such thing as a wrong tracking shot. Anyway, all right. Well, I have a little something that I was going to talk about, and now I can't. Oh, here it is. Okay, I found it. So I saw this article. I've been going back and forth with a couple people ever since I was on Anthony's show this week. because of course we always have to talk about the vaccine, and so now I'm a shill for Pfizer. It's like, no, I'm absolutely anti-mandate. I don't think you should mandate something that hasn't been approved by the FDA. And even then, I'm not convinced. I mean, you have to make a pretty good argument to mandate something.
Yeah.
And I think it's people's choice. And you look at the evidence, and the vaccine absolutely causes myocarditis in some particularly young men. But you know what else does too? The virus, and the virus does it. And if you look at, it's not my data. You look at the data, it's 27 times more. Now, I don't want to fall victim to using that relative risk. We've been talking about relative versus absolute risk. The absolute risk is still very low. So you could have the absolute risk absolutist saying, well, the absolute risk is tiny. The risk to the individual is very low. But then you would have the relative risk absolutist that would say, well, 27%, 27 times better suppression of myocarditis if you get the vaccine is important too. So I don't know. But the thing is now, the data I don't have, and if somebody asked me about this, I'd have to say you got a good point. So I'm just going to give it to you now. I am not aware that we have data that shows if you have the vaccine and then you get COVID that there is a commensurate decrease in myocarditis. I don't know. I don't know that anybody has that data. So we know that the vaccine causes 27 times less myocarditis. Well, maybe it's just weaker antigenically, make up a word.
Yeah, I like it.
It's just weaker as far as its immune response than the virus, maybe. So the virus is more likely to cause myocarditis. But what if, the vaccine isn't much good if it doesn't prevent it, if you then get the virus,
Right.
Because we know that the vaccine is not, it's leaky. It's not perfect for, and not even close to perfect for preventing cases.
No.
It is pretty effective for preventing hospitalization and death, though, in in the right people. But anyway, so I've been going back and forth about that. So now I'm a shill for Pfizer, and then one of them I just said, "You're aware that I'm anti-mandate, right?" And they were like, "No," and I was like, "Okay, then let's move on."
They don't care.
Well, it's like, listen to the whole thing. And so anyway, this is a great article, though, and it says, FDA vaccine advisors, quote, disappointed, unquote, and, quote, angry that early data about new COVID-19 booster shot wasn't present for review last year. And I put this up as a tweet. I said, oh, they're angry and disappointed. It's good to know.
Yeah.
For the lack of transparency, that's what this article is about. This was about Moderna. This is not a Pfizer thing. That showed the updated booster might not be any more effective at preventing COVID-19 infections than the original shots. Matter of fact, I think in their study, the people who did not get the vaccine in their placebo group, 1.9% of them, let me see if I can find the numbers in this article, 1.9% of them got COVID, and in the vaccine group, it was 3.7%. Now, there's lots of things. Okay. Sorry, let me see. Okay. Well, among subjects with no evidence of prior infection, as well as those with evidence of prior infection, disease incidence rates were 2.4% for the group that received the original vaccine and 2.5% for those that got the booster. So let's see. I know that there was another. Now, and then they go on to say that we're angry and disappointed, but it wouldn't have changed our opinion. Okay, then why are you angry and disappointed then? But the truth is that they weren't transparent. They didn't reveal all of this stuff. It may not have made any difference, but you can't. It looks bad.
Right.
It already looks bad. You've got people who don't trust. Now they don't trust scientific journals. They don't trust the New England Journal of Medicine, Journal of the American Medical Association, really top-notch journals that have real peer review. People aren't trusting that. They're not trusting our institutions, the FDA. They're not trusting the pharmaceutical companies, not trusting the WHO. I mean, people don't trust anybody. They don't trust the newspaper, but they do trust certain sources on Reddit and stuff like that. It's neither here nor there. Sometimes those sources are more accurate. I would tell you this: Joe Rogan's take on ivermectin was more accurate than CNN's for the longest time. And so how do you know? And I mean, who's vetting what Joe's saying? Well, you just have to. We always say do your research. Well, I've done my research, so I know some things. And that I disagree with certain people about, but this is bullshit.
Yeah.
And for them to have gone, I don't know if they're going to pass this if we show. I mean, that's what it looks like, and it doesn't help with the trust of the pharmaceutical industry, the FDA, and everybody. And so that's my hot take on that: is that not presenting all your data in front of the FDA is bullshit.
Yeah,
Okay.
it really is. It's like cherry picking what you want to tell them.
Yeah, don't do that.
Yeah.
And then
Just
because
give
they're
it
going
to
to find
'em
out
all.
later.
Yeah.
Now we've already paid them $2.5 billion or something. I don't know the right number of that. Together, the updated boosters from Pfizer and Moderna, it cost $5 billion to the taxpayers. We paid for that.
Mm-hmm.
Now I'm looking for there was other data here between the vaccinated and unvaccinated where it was surprising. I can't find the numbers now. Of course I can't, because my highlighted version of this disappeared between when I did show prep and now. But anyway, so we're angry and disappointed too, Mr. and Ms., Doctor and Professor FDA vaccine advisors. Glad to know that they're upset about it. But anyway, all right, Tacey, you had something, right?
Yes, I have.
Oh, wait a minute. This is we have a new theme song for you. This is Tacey's Topic Time. It's time for Tacey's Topic Time with Tacey. That's actually Carl from Who Are These podcast playing that, and that is the Harrison Blake Young theme song.
Sounds
done on
like
guitar.
Emily in Paris.
Does kind of sound like that because we're all about that right now.
Yes.
Ooh, did I say that?
Yes, you did.
Uh-oh.
Man, you are one pathetic loser.
So, yeah, but anyway, Harrison Young, I was on his show. It is on public access in somewhere in Massachusetts near Boston. And it was loads of fun to do. It's not up right now. Harrison is a different guy. He's a very different kind of dude. And he was profiled on WATP, and he took it so well that now everybody loves him. And Carl was on his show, and I was trying to get on before Carl, so just to kind of blow up his spot a little bit. But, of course, he's always one step ahead of me. Got on the week before. But it was fun. Half the time, his Boston accent is so thick, I could not understand the questions he was asking me. So
Right.
I just was going, hey, I don't know what you're saying, but here's this other thing I could tell you about. So we'll see if he keeps all that stuff in there, but it was funny. But that's his theme song, and Carl did it on guitar. So that's your new theme song, Tacey.
Well,
Okay.
I was going to say, I hate to interrupt. I was going to say, but I missed just. I was.
Oh, yeah.
working-
Oh,
I had-
yeah. You were supposed to be there.
Yeah, I was supposed to come. I have a 250-gallon saltwater tank. I mean, it's huge in my living room.
Yeah.
And when I called you, I thought I had a leak outside, which I did.
Well, there was a
Because
deluge
that
that
storm.
day. We had like almost like a tornado or a downdraft or something. And I'm like, oh my God, his house is flooded. He said, I can't be on Harrison Young because my house is flooded. And I'm thinking, oh
Yeah.
Lord,
Oh yeah, I didn't realize.
you better go.
I had two problems. I had one outside. That storm was so bad it blew a bunch of debris in our gutter, and the water was pouring out like almost into our house.
Wow, that is very interesting. Please tell me more.
And then I got, but my fish tank was the problem.
The only reason I'm letting you tell this story is because I was so concerned for you and your house. And then I
God.
find out it's a effing fish
It was
tank.
but it was two things. But
You missed Harrison
I
Young
had to
for a fish
I had to
tank.
replumb this entire damn fish tank. It was awful. And then I had to climb up on the roof because we had another storm coming at night. So I
Well,
was up on
that's
the roof
because
at
you're
dark.
an idiot.
So thanks for the sympathy, Dr. Steve.
In the dark, you climbed on your roof?
No sympathy.
You climbed on the roof
Yeah, that
in
night.
the dark after a deluge?
That's correct.
Well,
Yeah,
that's
and before the
because
other
you're
one.
an idiot.
Yeah, that's
That
not
much of a
smart, dude.
choice, though. It was awful.
God. Well, I'm
Anyway,
glad it's. But
I would have
everything's
much
okay.
rather been with you. I can promise you that.
Everything's okay now.
Yeah, thankfully.
Okay, good. We were going to play Put Me Down a Pallet on Your Floor for Harrison Young
Yeah.
and kill 5 minutes.
Yep. Just
Instead, I had to talk about urethral meatus and try to say it in such a way that it was okay for cable access.
oh my God.
Anyway, all right, Taste, what do you got?
Okay. I have two little small stories.
Okay.
The first one is that kids under 14 are dying of fentanyl poisoning faster than any other age group, according to a new analysis from Families Against Fentanyl. And fentanyl poisoning occurs when people become in contact with or accidentally ingest the synthetic opioid, which is about 50 to 100 times more potent than morphine.
Yeah, 100 micrograms. 100 micrograms. That's 100, millionths of a gram is equivalent to 30 milligrams of oral morphine. And they, when you take a little spoon and go, well, let's take some fentanyl powder and put it in here, you're putting, milligram to gram amounts in there.
Yeah, and I wonder how much of this is accidental, or these kids are like, "Hey, let's try this,"
Well,
I mean, it sounds like some of it is accidental, and
well, it's all accidental. They're not killing themselves on purpose.
no,
with fentanyl.
good point. And between 2019 and 2021, the CDC said that deaths 14 and under increased faster than among any other U.S. age group.
Ugh. Well, they're smaller, so it might take less to kill them. And I'll tell you what I've been seeing, and I've had a bunch of people in my practice who have had positive THC, so they're doing street pot in Tennessee. It's not medical marijuana, and legal.
No.
So if you're a cancer patient, you want pot, you either have to do the dronabinol pill, which is synthetic delta 9 THC, or you have to buy it on the street. And if you're buying it on the street, just north of us in Virginia,
Or I was going to say cross a couple state lines.
well, just one state line, there is medical marijuana.
Yeah.
And if you go into a dispensary, you can say, I want something to sleep. I want something to wake me up. I want to laugh. I want to eat. I want to be hungry. And they can give you stuff. Well, if you go to your dealer, they just have a bale of pot. So if they want to compete with the dispensaries, they have to put a little fentanyl in, lace that in the pot for the sleepy pot, and then they'll put methamphetamine in the other pot and
In the
say, this
wakey
is the
pot.
stuff, this is your wake up pot. And we have seen tons and tons and tons of this. Sometimes there's buprenorphine in it, but it's mostly fentanyl. Well, it's mostly fentanyl, buprenorphine, and methamphetamine that is this adulterated marijuana. And we used to be pretty tolerant, but now it's gotten dangerous. So what we really need to do is if that's going to be the response to having legal marijuana up above us, it's not, the response isn't crack down on it. Our cancer patients need it. Just legalize it. Let's get it over with. Because if you get your pot from a dispensary, it is highly, highly unlikely, to the point where it's vanishingly small odds that they're going to be lacing their product with methamphetamine, because they'll just get shut down.
Exactly.
The first gummy that goes out of there that somebody finds out they've got meth in there, they'll shut down. Those
They're
are
so screwed. Yeah.
millions of dollars of investment to set up one of those places. In Virginia, I believe that they have to do the extraction and the manufacturing on site. So I'm not 100%.
It's highly regulated.
But it is highly
profoundly,
regulated,
Yeah, it's good stuff. Yeah, see, the quality you can trust. Like almost it's regulated like a pharmacy.
Yep.
It really is.
Up
It's
there,
really-
the person running the one that I know about is a pharmacist. It may be that you have to be. I never looked into
I
it.
don't know. You might be right.
Yeah.
It would make sense though, because and I'm with you, and I've heard of another. Well, let's just say I heard a story the other day of someone who had thought they were getting a certain street drug and tested positive for fentanyl.
Yeah.
Yeah,
Well, yeah, we've seen.
cocaine was laced with fentanyl.
Really? Now,
Yeah.
why would they do that? Just another white
Just
powder.
to cut it, and
Yeah.
just to cut it, and I think to make it more addictive, I guess.
Maybe.
Yeah, it's awful.
There's
Terrible.
Yeah, it's awful.
we're seeing fentanyl pills that are stamped as if they're Xanax, all kinds of stuff like that. So and I've said this from day one, 2007. I'm not a namby-pamby, just say no type of person, but it is getting more dangerous out there to mess around with street drugs. Even if you think you're getting a prescription drug that you're buying from somebody, that, you know, it's stamped right, and you look at, you do a pill identifier, and it's correct, and it's still the wrong thing.
That's awful.
And we had somebody on this show that was several years ago that bought alprazolam or Xanax from what they thought was a Canadian pharmacy. When the box came, it was stamped the Seychelles, which is
right, I
off the
remember this,
coast of
yeah.
Africa. And what was really in it was haloperidol, which is a major tranquilizer,
Right.
also known as Haldol. We used to use it for psychotic people. We'll still use it for agitation, things like that. It has a similar enough effect that some people might be fooled by it, but it can also cause some serious side effects. One in particular called dystonic torticollis, where your head turns sideways.
Yeah.
I had let's say I heard of a case once when I was in residency of a guy that came into the emergency room and his head was turned like the Exorcist.
Right on.
You know, it was turned beyond where, and he couldn't unturn it. He couldn't look forward.
gosh.
It was just turned to the side. And I said, "What have you been doing?" He said, "Man, I've been doing speed all day. I've been doing speed." And I don't know. I said, "That's weird." Speed reaction. And he said, "Well, call my mom. She's got it." And so his mom had been giving him speed all day. And I got a hold of the mom, and she said, I said, "Can you read to me what's on?" She said, "Well, I've got a bottle of this speed." And I said, "Can you read to me on it?" And she said, "Sure, it's Navane," and it was Navaine, which again is another antipsychotic. And so he was taking mega doses of antipsychotics thinking it was speed and wondering why he wasn't getting speedy, but then his head kept turning to the side.
Oh, that's
Oh,
terrible.
rats.
So I went in and I gave him one dose of a medication called Cogentin intravenously. And his head just went back to normal. He's like, "Whoa, hey, thanks." And, he was
See you
shaking
later.
on- Yeah, see you later. And I'm like, "No more speed, dude. Jesus, come on."
word.
So my concern is, so I'm not a namby-pamby. Just say no. None of us in here really are, but. If you've ever had a pill that you got from the pharmacy that wasn't what it was supposed to be, that happened to our friend not too long ago, who got Cymbalta instead of her PPI. Don't say her name, but
I wasn't going to.
okay. I'm just okay. Wasn't that what it was?
Yes,
She was supposed to get her stomach medicine.
Yes.
And they gave her an antidepressant instead. And she wondered why her reflux was so bad.
Oh, goodness.
Why she was feeling weird. And it happens.
She was feeling really weird and just
bet.
terrible, and
Especially she's never taken
coming
something like
off
that
of
before.
it was awful for her.
Yeah. So she had problems with that too. So she had reflux and she had withdrawal from the Cymbalta because she'd taken it for a long time.
Okay.
And my point is not to not trust your pharmacist. Always, obviously, check.
Sure.
If you get something, you should always do that. You should check when you go to the grocery store and make sure that all the things that you thought were in there were in there. But the thing is that might happen one time out of let's just say a million scripts, 100,000 scripts is very rare, but it happens. But if I can't 100% trust my pharmacist, I can trust them 99.99999% of the time. If I can't trust them 100%, why would I trust somebody that's just selling me something off the street? I'm sorry, I just
pulling it out of his back pocket.
particularly or under their nuts like they did when I was in the Bahamas.
Yeah.
They were.
You witnessed somebody pulling stuff out of there.
Yeah, no, they were trying to sell it to me, and they're like, "Hey, you want some pot?" And I'm like, "I don't think so." And then he reaches into his pants and pulls it out from under his scrotum, and he's got these dime bags of pot. And it's like in the Bahamas, highly illegal. It's like, dude, put that away. I'm not giving you any money. I'll give you money to go away. I don't want your stuff. But anyway, why would I trust that?
No.
And particularly now, my message is a little bit more acidic because I've seen these things, and it's getting more dangerous. In the age of fentanyl, street drugs have become a little bit more, a lot more dangerous.
Yeah.
As the number of pills that are prescribed by physicians decreases. And I listen, we've thrown out the baby with the bathwater on for some of our chronic pain patients, no question about it.
Agreed.
And actually, Tennessee's response to it was really good. That they said, listen, if you've been on opioids for more than 90 days, we're going to leave you alone. We're going to try to prevent future cases of people who are injured by being put on opioids as a normal prescription. So they're limiting the amount that you can give for post-surgical procedures and stuff. But if you've been on it 90 days, it doesn't apply to you.
Okay.
And I when I first realized that, it was like, this is a rule that it has some common sense. So,
Right.
and it's kind of like, okay, this bunch of people, we're going to deal with them later.
Right.
Maybe, if they need to, we'll get them into counseling. We now have 2 or 3 places here where we used to have 0 for drug counseling. So, and that's increased throughout the country to some degree. So we're doing something about the demand. But anyway, now I don't remember what I was talking about. Anyway,
But you are
that's
correct.
rambling.
Yeah. They're making some good strides forward.
Shit. I had a point to make.
Uh-oh.
Yeah, and I got off on the rabbit. What?
You were dreaming of the
Well, I was dreaming of the
legalization
great
of
point.
weed.
Yeah, maybe that's
in the
what
state
it
of
was.
Tennessee.
What were we talking about? We could be
Can I do my
planet
new
on a
story now?
thumbnail of a
Because
giant.
You're
sorry.
just getting weird.
Okay, sorry.
Okay.
I was doing pod talk.
Yeah.
Go ahead, Tish.
Okay, so a California woman contracts HPV-related nail cancer following a visit to a salon.
Nail what?
Yes, it was a new salon. Her salon was booked, and her cuticle got nicked. It got nicked deep, and the
Okay.
wound didn't heal. After months and months and many doctor visits, her doctor sent her to a dermatologist. And she got a skin cancer diagnosis, squamous cell carcinoma,
Okay, yes.
which was caused by high-risk HPV stage 1. The doctor said almost every skin cancer involving fingers or nails have been associated with high-risk HPV, and it's in younger patients. But the vaccine prevents it.
Yeah, so the Gardasil will prevent cancer from HPV 16 and the other one. So get your kids vaccinated. We got ours vaccinated.
Yeah.
Doesn't stop them from getting HPV. It just stops them from dying from the bad kind of HPV.
Yeah, I still wonder though. I mean, if that's the case, I wonder why they don't change the recommendations and they can't get the shots even if you're older than a teenager.
I
know
think you
it's-
should be able to do a serologic test because they're saying, listen, if you've already been exposed to it, it doesn't do any good.
Okay.
And maybe it does some harm in that case. I can't imagine that it does, but okay. So they're saying, but they increased it to 23. But I think if something, God forbid, happened to Tacey, and I would go get a serologic test, say you've never been exposed to HPV 16. It's like, hell, sign me up.
Give me a shot, baby. I'm cutting loose.
That's right. But anyway, ugh. Oh, I do remember what I was going to say. We were throwing the baby out with the bathwater with the chronic pain patients, but we have decreased the amount of opioids that are on the market that are prescription opioids. And as you see that falling precipitously since 2010, you see the number of overdoses from opioids rising at an almost exponential rate. Now, why is that? It's because when you're taking prescription drugs, you sort of know, hey, I'm 40 milligrams of oxycodone is sort of my jam. But when you get a little packet of powder and somebody's dumped fentanyl in it, and there's no way to know how much is in there, then it's much more dangerous. So anyway, that was the point I was getting
That was
at.
a good point.
Good point.
Thank you.
That was well worth it.
Anyway, yeah, and get your kids vaccinated for the Gardasil. That one is FDA approved. It's been demonstrated to work very well, and we are going to see continued decreases in deaths from cervical cancer because of that vaccine. We're already seeing significant decreases in precancerous lesions. Hadn't been out really long enough for women to get old enough to
Well,
start.
and you wouldn't think HPV on a finger, right?
Yeah,
You wouldn't think that.
sure.
So if you've got a
It's a
place
damn
that's
cancer
not,
virus.
yeah, if you've got a place that's not healing, Go to the dermatologist.
Yeah, oh, that's true.
Get it checked
Good
out.
point, Tace. You know, yeah, HPV, that one, wherever it goes, you could have problems if it ends up in your nasopharynx, because I don't know, perhaps you put your mouth someplace and it was quite delightful at the time, but you got a little virus in there that can cause head and neck cancer.
Yes.
If secretions and fluids drip down and get in your anus, it can cause rectal cancer. I'll assume that's how that happens. And then, cervical cancer for sure, and penile cancer. So it's all the places where that HPV can go. And it is unlikely for those human papillomaviruses to end up on skin, but if you get a nick like that person did, and they've got the virus, and it's just a perfect storm of shitty events,
Bad
then
luck.
it can
Yeah,
happen.
That's bad. That's bad luck.
But now the squamous cell skin cancer is usually very easy to treat.
Oh, good.
Yeah,
Good.
So, all right, very good. Well, thank you, Tace.
I did homework.
You
Way to go,
did.
Tace.
It's number one.
Yay.
Uh-oh. Oh, wrong pot. Sorry.
Give yourself a bill.
There you go.
Oh,
And also,
Suck it.
stabbed to the heart.
Suck it.
this has been Tacey's Topic Time with Tacey. Associate producer, Dr. Scott. Music by Carl Hamburger. Topic Time theme used by permission by Harrison Young. Wish I had a script for that. I would have done a little bit. All right, very
The
good.
bill-less.
Do we have
Dr. Scott,
questions?
right?
Yeah, sure we do. Do you want to do some questions?
Yeah, I think people like it when we do
Number one thing,
questions.
don't take advice from some asshole on the radio.
All right, we'll do it. Here we go. Thank you for your questions, everyone.
Hey, Doctor.
347-766-4323, and your questions mostly get answered. I downloaded one from 2014 today that we never got to.
Oh, goodness.
So, I know. Anyway, we might get to do that one.
You, Dr. Scott. I called in a few weeks back about need to urinate or urge to urinate after I jerk off.
Oh, yeah. And I actually, dude, I talked about you on Harrison Young's show. That was one of our most requested questions is post-coital male, urethral burning.
You gave me the advice to soak my junk in warm water, and want to let you know that actually worked quite well.
Yay.
The sensation subsides after just a couple minutes as opposed to, half hour to an hour. So really good tip to not keep me up at night. I also have a
Give yourself a
for,
bill.
Give myself one.
question. I have gynecomastia. I've had it. I developed it probably as a young teen when I was quite overweight.
Okay.
But with a teenage history of eating disorders, I went from very overweight, obese, to anorexic and underweight. But even through all that, still had gynecomastia.
Okay.
Now I'm healthy, fit, 20-something, and still have them.
Okay.
Still have my tits. They're probably about an A cup, so fairly sizable for a male. Anyway, was just curious if, as I get older, I should be concerned about possible increased risk of breast cancer, and if that's something I should talk to my doctor about getting screened for as I get older.
Okay, yes. So let's talk about gynecomastia. It's just enlarged male breast tissue.
Right.
And it can be caused in boys or men, usually caused by imbalance of hormones between estrogen and testosterone. And so when he was overweight, he was converting some of his precursors to estrogen instead of testosterone. And fat tissue plays a role in that. And so he built up some glandular tissue. And when he lost weight, it didn't go away because the glands are still there. Right. Now, there is a thing called pseudogynecomastia, and that's where people just get an increase in fat tissue, but not glandular tissue. And those people, when they lose the weight, the breast tissue goes away. Now, newborns will can sometimes get nodules under the nipple, and moms will go crazy thinking that, oh, my newborn has breast cancer. But a lot of times that's from estrogen transferred to the boy from the mother's bloodstream.
Okay.
While they were attached together in the placenta. And older men can get it just because they're not making as much testosterone anymore. And then boys going through puberty sometimes would come in and they would have this sort of firm nodule under the nipple, and moms would again be freaking out, or the kid would be, and we could reassure them that was going to go away. But if you have enlarged breast tissue, very often it'll go away if it's transient through puberty. But if you're an adult and it doesn't, then you can do stuff about it. So there are several things that can be done. Scott, you got any info on this from your standpoint?
Well,
before I go on to the Western medicine part.
Well, I was going to say exactly like you. Typically, it's just an imbalance of fat tissue. I've seen it in young males that have a really heavy diet full of chicken.
Oh, because they're getting it from the hormones.
Instead of hormone-free chicken.
So you want organic chicken, man.
Or
Have you seen some of these chicken breasts?
Non-hormone fed.
Sam, the cooking guy, had a chicken breast on the other day. I swear it came from a turkey. It was gigantic. It's just not normal.
No.
So poor chickens were just ripping their chest muscles off and their legs. And just eating their legs.
It looked good, though.
They are so good.
Gross.
You get 4 of them. You get 2 wings and 2 legs off each chicken. It's pretty damn good. Thigh meat's all right.
That's awful.
Then we boil their carcass down and make stock out of it. Jesus.
And you fry the skin.
Yes. And then we're eating their skin. Just imagine if chickens were sentient. They would be horrified.
That would be awful.
It's just chicken apocalypse.
Oh my word!
There's chicken everywhere.
Yes. Happy years ago. I mean, it's been 10 years ago.
Yeah, we were talking about
Super Bowl.
Super Bowl. How many?
The chicken. I'll look it up.
Almost got. We've got a new friend on this show is ChatGPT. Of course it's Saturday. ChatGPT is too busy to talk to us. I actually paid for one. We have an AI assistant now called Right Sonic. Go ahead.
I just Googled. It said 1.42 billion chicken wings
just on
Super
Bowl
Sunday. 1.42 billion chicken wings.
So that's so that would be what 550 million chickens.
Yeah, or
something like
600 million. Yeah,
poor chickens.
700 million chickens.
Ugh.
Hell,
and they're born, and you come out of you peck your way out
they're
of
feeling
the
pretty good about
egg
themselves. Or eating some
and
good
you look
food.
around, and it's like, what the fuck is this? Where'd all these other chickens come from? Why does it smell so bad in
nice
here?
air conditioned area. They're loving. Their friends are running around.
I do buy. I've fallen for it. I buy the free range chicken shit whenever I can. I mean, they still kill them and eat them, but it just seems somehow less just horrific. But anyway, we're having chicken tonight, and it's awfully tasty. So sorry, chickens. Where were we?
Oh, we're talking about gynecomastia.
Gynecomastia.
We have good couple things from the waiting room. Go ahead.
So treatment. If it's just transient hormonal changes, no treatment is required. And
will it go away?
That's what I'm saying. The transient ones do.
Oh yeah, transient.
The ones that were, the ones that are related to puberty or newborn and stuff like that. But if it doesn't go away and you're an adult, and like in this guy doesn't go away, you can take medication. There is a medication called tamoxifen, which we use in. It's an aromatase inhibitor, and we use it in breast cancer to suppress estrogen at the level of the cell, estrogen's effects on the cell. And Arimidex is another one. And they are not approved for use in gynecomastia, but they have been. Would I put a young male on tamoxifen or Arimidex or other aromatase inhibitors? I don't know if I would. They can also, the aromatase inhibitors can also cause aromatase inhibitor associated arthralgia. In other words, they get pain in the joints from taking those. It's about 5%, but still, you got to be aware of that. But the other thing is it's liposuction. If you're in good shape now and you've got muscle tissue under there and you just do the thing, that's I've seen males do liposuction before and done very well with it. You want to find a place that does a lot of it, that are well versed in doing this. There are some complications that can be had with liposuction, but that would be my preferred thing. You do have to screen for breast cancer, but all males do.
Yeah.
1 out of 100 cases of breast cancer is in a male. And I think there's only like maybe 2,000 cases of male breast cancer actually diagnosed annually, and about 400 men die of it. So if that number is right, that means about 1 in 5 die from it. So you want to catch it early. Early detection is the thing. So feel for it.
So is this issue?
It's a very, very small increase in risk.
Are you more likely to get breast cancer if you have it?
Very slight increase in risk.
Very
So
slight.
instead of 1 in 100 people, it might be 1 in 95.
Okay.
Something like that.
Okay.
Or 1 in 100 cases is a male, and of those, maybe a few of those wouldn't have gotten it if they hadn't had gynecomastia. Put it that way. It's probably a better way to state it. All right. Good idea to do periodic self-exams. If you've got really big gynecomastia, then you're going to have to get a mammogram. And removing that tissue, of course, will decrease your risk back to normal for getting male breast cancer. But I don't know that I'd go so far as having a mastectomy unless I just had, like D cups or something, All right. But see, a plastic surgeon. Plastic surgeons are the ones that deal with that.
Yeah.
All right.
Hey, look who just joined us.
Who's that?
Stacy DeLoach.
Oh, really? Oh, hello. Hello, my friend. We don't have any Stacy DeLoach questions.
I know it. We're having to make questions up.
I know. You're right. We're having to make up questions. Let's try this one, though. I think this is a good one. I have to add the .mp3, though. Sorry. I apparently didn't do that when I put this in here. There we go. All right. Let's try this one.
Hey, guys.
Hey.
So, by the way, Santa loved himself a woman that wasn't clean.
Okay.
That's a line from Bad Santa.
Oh,
Billy Bob Thornton.
That's where that came from. Okay, he said that last week. It's the same guy.
Okay.
Okay, all right.
Anyway, so I did my...
Never seen Bad Santa. I don't like bad Santas. I like good Santas. except if it's what did we watch? Violent Night.
Violent
It's the
Night
most
was
ridiculous
awesome.
thing. I loved it. So stupid.
My cycle of antibiotics and whatnot.
Yes.
And my drippy meatus seemed to...
I'm going to give you a bell for the proper use of that
Give
word,
yourself
my
a
friend.
bill.
Yes. The meatus, a.k.a. the cock hole.
But back now, so I guess I'm going back. Anything I need to look out for, ask for,
Well, okay. Yeah, I want to know what they tested him for.
consider whenever. I did get the 2 tests for gonorrhea and chlamydia.
Okay.
Those both came back negative, so they had me pee in a cup. That's all I did, really. And they gave me antibiotics and showed me the door.
They had you pee in a cup. I think that is less sensitive test than sticking a swab up your meatus and letting it sit there for 20 seconds and then twisting it around. It's agony. I mean, it causes some significant discomfort, but it is a very small swab. But when it's going up your urethral meatus, it feels like it's 10 miles wide.
It's a sensitive area.
Slightly. Slightly. So, there are other STDs. If they didn't look at it under the microscope, they couldn't diagnose trichomonas. They may have missed chlamydia and gonorrhea, and now the problem is they put you on an antibiotic, and so they're going to be less likely to detect it now, even though there might be something residual there. You may have a thing called nonspecific urethritis. There is a treatment for this. There's a treatment protocol. A lot of times they'll give you a shot of Rocephin or ceftriaxone and then give you doxycycline for 10 days or whatever. And there are some resistant strains too, and those need to be treated differently. So they need to do the next level diagnosis. So please go do that. Let us know next week. This will be third week in a row what happened to you and if you got any relief. So on just for everyone else's edification, wrap that rascal and use something to prevent disease, okay? All right, thank you. End of soapbox.
Hey, Dr. Steve.
Ooh,
I'm calling from Pennsylvania. My name
girl.
is Sandra,
Hello,
and
Sandra.
I'm calling about my husband. He
Boo.
Yeah, right. We've heard that before. Nice try.
he has he's not ever been circumcised, and he is now in his mid-50s
Okay.
and is having issues with the skin not being able to pull back over his head. And we have some problems in the bedroom when we enjoy one another's company. It gets torn.
What's that
and
like?
Then is out of commission for a couple of weeks.
Ooh,
So
I
he
bet.
really doesn't want to get a circumcision at this point in his life. But we're kind of scared that he might need that because it seems like he gets scarring on his foreskin and
Yes.
it's not able
No, it
to
doesn't heal.
retract, and it's going to cause
Yeah.
more problems. So
Right.
we're not
Oh.
really sure where to go with this. We have seen a urologist and really didn't get a lot of information at the time, so kind of just wanted to get your idea. I've heard there are creams
Yes.
that could possibly help. So just let us know what you think. Thanks.
There are, and thank you for calling for your husband. Matter of fact, she sent me a message on the voicemail thing because I try to respond to the voicemails, and she said she appreciated Tacey being here to discuss female urologic things.
Cool.
But then she said having a dick. Well, no, what it was she said, thanks for helping me with my husband. Having a dick sounds like it's, really a pain in the ass. And I said, well, there's an obvious joke there. But I said, having a vag also is no walk in the park, according to my wife. And she said, thank you for Tacey for being here to give the woman's
That's
side.
very nice.
That there are
There you go,
actually
Tace.
women listeners other than Amanda. And who
Her
else?
and the other
Patty,
one.
and
Yeah,
Patty,
Patty,
yeah,
yeah.
and the other one. Patty, you're now the other one. So anyway, and if you wonder who we're talking to people in the waiting room.
Yes.
Which you can join us on YouTube Saturdays at 1 p.m. Just follow my Twitter at Weird Medicine, and usually around 1 p.m. I'll tweet out the link, and then you can come just hang out in the room. And we don't make a big deal out of the video presence. If we have 10 people, I'm happy. We get all of our
We have
stuff
fun.
from listens on our podcast and on SiriusXM. But anyway, okay. So creams. I think this guy's beyond creams. If they're having sex and his foreskin is ripping and then it's scarring down, I think really we're beyond cream. He could try it. They'll give them a hormone cream that will help to loosen up the foreskin and try to get it to retract back. But this is what's going to happen if it continues to scar. And this is called phimosis, by the way. If it continues to scar, one day he's going to retract it, and he won't be able to retract it back.
Oh.
And when that happens, that is a medical or surgical emergency. If he doesn't get surgical treatment stat, what'll happen is the head of his penis will slough off.
Slough off.
He'll kill it, and it'll slough off.
Oh.
Yes.
So not a lot of options, really.
No, I would. I mean, if he really just doesn't want to have a circumcision, go ahead and get the cream. But you're going to want to see a urologist. See them now. Let them examine you, and they're not going to be knife happy on this. They know people don't want circumcisions. They don't exactly get a big kick out of doing adult circumcisions either. But our friend Jefferson the Shyster had one. And he showed it to us here back before we had cameras in the studio. And he was playing baseball the next day. So it used to be if you had a circumcision, like Sam Roberts had one. This is what Sam Roberts had. Sam Roberts' phimosis was so tight that he couldn't retract it at all, so he didn't have problems with it ripping. But when he would pee, it would fill up like a balloon, and then he'd have to squeeze it, to get the pressure up high enough to get the urine out. And if you've gone that far, I mean, I think he was 18 or something. He was young, and he had an adult circumcision. Well, adult. I mean, is Sam even an adult now? But he had an adult he had a circumcision over the age of 18, and I think he was on the couch for a week or two. But they do it differently now, and the way Jefferson's was done was different than I've ever seen it. Where he had a ring of stitches going all the way around, where they had joined up the shaft skin with the
Roman war helmet
with
skin.
the Roman war helmet skin. Yes.
Yeah, he had almost.
I'm just
zero
talking
pain.
about shaft.
No, yeah, he had almost no pain.
Yep. No, nothing.
Yeah, he did extremely.
Literally playing baseball the next day.
Yeah, I would say in lieu of tearing at him, I'd probably look at some.
Yeah, just go see a urologist.
Yes, trim.
And you could probably convince them to just give you the cream, but I really think at this point it's affecting their enjoyment. He doesn't want to do it because every time he does it, it hurts.
Yeah, so
I mean, you hear about women who have dyspareunia, which is pain during intercourse, just don't want to have intercourse anymore. If you have pain when you eat, you don't want to eat. When my feet hurt, I don't want to walk. I totally get it. So if it's affecting your ability to, dance the dance of the two-backed beast, then I would absolutely go get that fixed.
Well, they did go to a urologist. Maybe go to a different one.
Oh,
'cause they didn't
did she
get
say they
any-
went to a urologist?
Yeah, and
What
she
did he
said
say?
they didn't get much of
What?
any information. Yeah.
Oh, shit, I missed that. I was
somebody wasn't trying.
too busy
Yeah.
thinking about what I was.
That's
Oh,
awful.
no, that's terrible.
That's awful. Somebody
Yeah.
wasn't trying. Come on, make an effort.
If they just blew you off, I probably would not go back. Now, but this is a good point to talk about in general. If you go to your primary care provider or anybody else and they give you something and it doesn't work, don't go, well, they don't know nothing, I'm going somewhere else, because that person's going to have to start over from square one. Go back to that one, say, hey, this didn't work. Can we go to plan B?
Yeah, what are your other suggestions?
It
Yeah.
tells them
that's a good point.
when the obvious thing isn't it, then it tells them that, okay, it's like you're doing an experiment whenever you treat somebody. And if it doesn't work, you are informing them that that hypothesis was incorrect, and now they'll have another hypothesis. We have these things called differential diagnosis. And we start working our way down the list. So give them the opportunity to try to make good on that. Because a lot of times that first intervention that they're doing is just a test to see if they got it right the first time. All right. Thanks, everybody. Thanks.
Yeah, man.
Probably because I took a Provigil this morning.
Did you quick clock us?
Yeah. Are you you got, and you said you had some stuff in the waiting room, right?
Yeah.
Let's
I've
do
got
that.
two little short ones. Yeah.
What do you got?
Got one from Brooks. 89
Well, just tell
Brooks.
me real quick just the topics in case I need to look something up.
No, you don't. You
Okay,
don't.
I
It,
don't.
it was about TCM. Me treating gynecomastia with herbs.
Oh, okay. Yeah,
and,
yeah.
And
Okay.
the other one was about what are our thoughts on chiropractic care?
Yeah, okay. Yeah, that'd be a good one to do.
Yeah, we'll do two good ones. Yeah.
Let me pull up my Right Sonic thing, and we might do have the AI work with us a little bit today.
Oh, goodness.
We now have an AI in our employ, and they are our backup for certain things. What?
I was billless for this show. No bills for me.
Oh, didn't you get any bells?
No, and that's right.
Well, you still have time. You're going to get a bell
No,
on
I
this.
don't want it. I don't want it.
No, he didn't
I
want
don't
one
it.
now.
That's
No.
Nope.
Uh-uh.
Too late.
Uh-oh, I'm getting here. YouTube is not receiving enough video to maintain smooth streaming. What's going on? Uh-oh. Okay.
We just, for some reason, just started breaking up a little bit there. I'm still talking to everyone.
I'm just asking the group, is the audio bad too or just the video? Okay, they're saying sounds fine. Okay, I'm going to try something. I'm going to try to do this without ending the stream. If I do end the stream, I'll send out a new link.
Yeah, Sean, mine got a little bit choppy right then too, but I think he's fixed it.
I'm getting an error.
Yeah.
It says the stream's current bit rate is lower than the recommended. Why?
Clint from Illinois. What part of Illinois, Clint?
Hey, which Clint is that? Stream's current bit rate, 1925 kilobits per second. Why?
It's almost like the internet just got a little draggy.
Okay, well, let me see.
You mean check the internet speed?
Yeah, if you don't mind.
Hold on. I'll do it right now.
Oh. No, everything looks good on this end. Huh. Okay. Well, it says open widget. Okay. Stream status says good, but not great. Stream settings. Everything's okay.
Yeah, I think it was just a blip.
Okay.
You know, we're 70, 80 megabits, almost 90.
Yeah. It's weird, isn't it? Okay. Might be something on YouTube side too, I guess. Okay. All right. Sorry, everybody. And now I'm not getting the error message. So.
Cool.
All right. Let's get the AI fired up. You know, like in the peripheral, when Low Beer was talking to the Auntie's taste, that's me now.
No, we don't.
Because she was consulting the AIs.
Oh, goodness.
I actually use this for my work. All right, well, let's get back into recording here. Okay. All right, and you've got some questions. Ready? Ready? 3.
Almost.
Okay.
Give me 2 seconds.
Okay.
They were way up.
Yep.
Yeah, I'm ready.
Okay.
Ready.
Okay. 3, 2, 1. So, Dr. Scott, you got anything else for us?
Yeah, we've got 2 from our Fluid family.
Oh, is that what it is now?
That's our. We have a new
Fluid
name.
Family.
The Fluid Family.
They name themselves that.
Yeah.
You know, if you name yourself a nickname, it doesn't stick. But that.
Well, technically,
That
I
one I
suggested
think will,
it.
though.
I suggested
Fluid
it.
Family.
They agreed.
They,
it was better than
they're
waiting
gender
room.
fluid.
Yes,
How about that?
Yes. I don't know. It's too late, Dr. Steve. We've already been voted out. That's the Fluid Family.
Okay. All right,
So
fair enough.
So Kevin 28.
Well,
was
the
just,
Fluid Family. Oh yeah. Hey, the fluids are in the waiting room. It's the
Yes.
Fluid Family.
Exactly. You got
Okay,
it.
fair enough.
See, Dr. Steve's in now, guys.
I'm into it.
Yeah, so as an MD and a TCM practitioner, how do you guys feel about chiropractors? Is it effective for neck and back issues, or is it snake oils? The history and founding of the field seems a bit questionable. You know,
Well, the history and founding of
Medicine.
medicine is really questionable, so I wouldn't worry about that.
no, I think it's just like every single profession. There are some chiropractors out there that are absolutely incredible.
Yeah.
I mean, healers, brilliant people, and then there's some not so couth chiropractors as well. But I think many of the ones that we use are super. They know their stuff. They know when to do their medicine. They know when to refer out for help. And so I think it's just like anything else. If you find the right one, they're probably pretty special people.
Yeah. If you go to, a body shop and they start saying, well, I could, make you,
I'll
I
fix
could
this.
make you a pretty new dress, that would be stupid, right?
Yeah.
And so if you go to a chiropractor and they tell you, I'm going to cure your cancer with coffee enema, that's outside their wheelhouse.
Right.
That particular treatment would be outside the wheelhouse for just about every
Anybody.
provider. So, but chiropractic care is considered effective for various forms of neck and back pain, and there are some, research studies, and not all of them are in chiropractic journals, that say chiropractic adjustments may be effective treatment for acute low back pain and neck pain, stuff like that. The problem is it's very hard to do a double-blind, placebo-controlled study, but if you go see one and they want to sign you up for 20 visits and hey, pay up front. How about let's do a couple and see how it goes.
Yeah, see where it's going. Yep.
And I'm not saying they're unscrupulous. I mean, there are, like Scott said, there's unscrupulous people everywhere.
Sure.
We used to have a chiropractor on the show all the time.
She was
She's
incredible.
Sadly, no longer with us.
She was an angel.
But Dr. K was awesome. She was fun to have on here, and she knew some stuff. And when it came to back and neck pain, she'd pop in. And but she was one of those, as you said, that knew their lane. It's like I have got to know my lane in medicine.
Yep.
You know, I shouldn't be, trying to give people chemo.
Yeah.
Because I have not been trained in that. And I tell my patients coming to me for influenza at this point is like going to Lane Bryant for tires. So, anyway.
Hey, Kevin had a follow-up question. Hey, why doesn't Dr. Steve has as bad of a hillbilly accent as Dr. Scott and Tacey?
Oh, there's a good question for that.
I answered it for you.
a good answer. Oh, you did?
I told him you're the highfalutin hillbilly.
Yeah, that's right. No, I do have
You do.
that.
I know you do. I know mine's actually worse than this.
You just don't hear it because I went to school to get rid of it.
Yeah.
And my original degree was in broadcasting, and to graduate from the radio, television, motion pictures program, you had to take Earl Wynn's Speech 1 and 2. And what we didn't know was what he was doing was indoctrinating us in a neutral accent, and we had no idea. We would go in there every day and go, why in the hell are we having to learn this international phonetic alphabet? So they would give us this thing called the International Phonetic Alphabet has a symbol for every sound that the human vocal cords can make. And so if you look at Liverpool, because I could have said then, you sound like as if you were Liverpudlian. But what they would do is they made us, the first semester was just learning the International Phonetic Alphabet. And every day we'd go in there and we'd have to learn more symbols and then say them. And then the second semester, you had to read scripts that were written in International Phonetic Alphabet, but it was written with neutral accent in mind. And so a lot of my Southern accent has creeped back, of course, because, it's been 40 years since I went to college. But at the end of that class, none of us had our native accent anymore. Now, I used to, when I lived back there in the holler, I would talk more like that. That's a little bit of a parody now, but that's a lot closer to the way I used to talk than this is.
I mean, I take out a lot of my redneck accent to do the radio show. So,
Yeah,
if you think this is bad, you should hear me in real life.
You should hear her when she's...
Especially after she's had a drink or
Oh,
two.
good Lord.
Lord.
And kicking somebody out of the house because
Lord,
cried
yeah.
or
When
something.
she gets that hair on the back of her neck stands up, you better look out.
One time, this
look
guy,
out.
we had our kid in the car. We were going to the beach for the first time with our kid. He was probably, 6 months old, 8 months old at that time. And some guy, I pulled in. I didn't know he was pulling out. He started cussing at us and all this stuff. And he started yelling at Tacey. Well, she started saying stuff to him. I'm like, hey, dude, have a great day and all this. But he wouldn't stop.
Oh, no.
And then he's like, I'm going to kick your ass. And Tacey was like, well, I'm going to kick your ass. And he said, oh, get the hell out of here, you fat, ugly cow, or something like that. Now, listen, back then particularly, this was, 20 years ago, Tacey was quite the striking young lady. And she
was.
Shit happens, but
well,
thanks God.
All right. I'm not, how do you say that? Tacey was hot just like she is now.
There you go. Now it's better.
And, I kind of fucked that one up, didn't I?
It's true, Steve. It's all right.
But, you were anything other than what he was calling you, and Tacey was like...
I had my phone, and I said, look, the police station is across the street.
Yeah.
I'm dialing 911 right now. Get the fuck out of here right now.
And then he was like, you're ugly. And she's like, I'm hot. I'm hot. Sounded like Angela from 90 Day Fiancé.
Now listen.
What else you got?
Yeah, last one on Brooks. Just asking about if there are traditional Chinese herbs that can help with the gynecomastia.
Yeah, that's a good one. Do you have any sort of estrogen blockers? I know you have all kinds of pro-estrogenic things.
Well, what I would do first of all, there are a class of herbs that help drain phlegm. So that's one thing I would use. The other thing I would use is a class of herbs that might help enhance the testosterone production and support the male.
Well, why don't we just do a PubMed? Just see if someone's ever done a study on that.
Yeah.
So
check out Rusong.
How do you spell it?
Rusong, RUCONG.
CONG?
Yeah.
Okay. Rusong.
Rusong Wong.
WANG?
Yeah.
WANG. So you're going to Rusong your Wong?
Well, you would give you the scientific.
Yeah.
CISTANCHE.
Okay,
Cistanchi tubulosa.
Cistanchi
tubulosa.
Tubulosa. Oh, there it is.
And of course, you can always use astragalus.
Astragalus,
yes.
right? Okay,
Yes.
Cistanchi tubulosa and gynecomastia. Let's look at that.
Oh no, I bet it's never been. I'm just
you never know.
You never know. Yeah, it could
Nope,
be.
nothing on that.
Yeah, but that's what I would use something like that. If they wanted me to try and help, that's what I would do first.
Okay.
Yeah.
All right.
And first, take them off of chicken, hormone-fed chicken for sure, or anything else that might be making.
Yes, that might be
the hormones,
exacerbating it.
Yeah.
Good one. Okay.
That's what I would
All
do.
right.
Hey, Carla's made it.
Who?
What's up, Carla?
Carla.
Carla Finch.
Oh, Carla. Yay. Hello, Carla.
Bet.
We were on her Bennington group chat one time. You remember that, Taste? That was fun. It was during COVID. And we got together downstairs, and there were all those people on the thing, and we talked to them.
Oh, yeah.
Yeah, that was Carla set that up. All right. That was fun. Okay.
All right.
Are we done?
Yep.
Okay. Well, thanks, everyone.
Thank you.
We really appreciate you being with us. Appreciate the support on the. And after we're done, we have to do a cameo
Right.
for our buddy Clint's mom. Okay.
Mm-hmm.
Without saying any more than that, but yeah, we got to remember to do that. So let's
10-4.
not forget. All right. And we appreciate everyone. I said that. Let me just back up. I probably shouldn't have said that about the cameo either. Hang on. I think it was private. Hold on. All right. Well, thanks, everyone, and appreciate everyone being here and everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. And don't forget Dr. Scott's website at simplyherbals.net. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Goodbye, everybody.
Bye, guys.
All right, let's do the opener.
I'm going to say something real quick. Hey, Ivers, if you're still there, we'll get your question next week.
Oh, well, we can add another question. What was it?
I'll just save it for next. It's plantar fasciitis and knee pain.
We can just answer it now. It doesn't have to be on the show unless they just
well, we
want
can do it
on the
right
show.
now, then we can do it for next week.
Tell
as
them,
well.
tell him or her what they want.
Yeah, real quick. Plantar fasciitis. The cure is, and hear me say this: Chaco shoes. You can get Chaco shoes, and typically,
and they're tasty too.
It'll shift your weight back. It'll take the pressure off your arch, and usually that fixes it. I've only seen it not work one time.
Okay.
The other key, real quickly, for knee pain, we don't know what kind of knee pain he has, but the key to good knee health is long hamstrings.
Yes.
Hamstring stretches,
Quadriceps exercises.
Good blood flow to your knees typically helps. Yeah, if he'll let us know exactly what kind of knee pain you got, we can be more specific.
Yeah, send me an email. I'll forward it to Dr. Scott. But Google quadriceps reflexes. Exercises.
Straight legs specifically, quadriceps.
Right.
Yeah, straight legs specifically.
For patellofemoral syndrome. If you have difficulty going downstairs, particularly, that's a big one, or downhills.
Colin Carnes just broke out a. Okay, see if you know this reference. Colin Carnes says, "Don't worry about losing your accent. A Southern man tells better jokes." Do you know what song that comes from?
No.
Jason Isbell.
Oh, well,
Jason Isbell. CC. So I got.
See, I didn't get into, even though I lived in the mountains, I didn't get into mountain
Jason
music until I was an adult, because as a kid I was listening to Brian Eno and
wow.
Yes and stuff like that.
That's where you went
missed
wrong.
out on all that stuff.
Tasty.
Yeah, Jason Isbell is good.
Yes.
All right.
The song is Outfit.
All right, let's do the opener.
Your father is so Superman. Did you hear about the robot that went skinny dipping? It was quite shocking.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. Why am I saying now a podcast after like 15 years of doing it as a podcast? I don't know. A little too lazy to change the script. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner. Oh boy, this is going to be a good one. Who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my wife, Tacey, who is my partner in this and all things. Hello, Tacey.
Hello.
This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question, you're embarrassed to take to your regular medical provider. If you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Really just too lazy to go back and do it over again and do it right. Sorry, everybody. Check out stuff.drsteve.com, stuff.drsteve.com for all your shopping needs. Still working on drsteve.com. All the stuff is still there. It's just in different places, so click around. If you see the three dots, click on that. All those menus will come back, and I'll have it up just as soon as I have 5 minutes to work on it. And check out Dr. Scott's website at simplyherbals.net. And then Tacey and I are doing Patreon at patreon.com/weirdmedicine. The Gino Visconti show will be edited today and up today. So if you're hearing this, well, that's my plan anyway. It was an hour long. It was supposed to be 15 minutes of him just yelling at us. And then now I have to listen to the whole thing to cut out certain words that I even on Patreon, I'm not putting on there because Patreon is leaky too. People can post it. Well, look at what Dr. Steve's allowing his guests to say. So anyway, all the stuff about the vaccine, that's fine. Whatever he wants to say, that's his thing. But they're just, like I said, some naughty words that I can't. And I told Anthony about it when I was on last week, and he said, "What a surprising thing to have happen." Gino said something inappropriate. Anyway, so there's that. How's Simply Herbals going? Oh wait, we'll talk about that in a minute. And
a bunch of surprise.
Yeah, okay, let me see if I fucked that up because we talked about it on the regular show. Hang on. Okay, I'll go from there. Anything else I need to... Oh, Cameo. And if you want a cameo done in the studio, go to weirdmedicine.com go to cameo.com/weirdmedicine. I'll say fluid to your mama. We're going to do one today here in the studio. Say you want to do it in the studio. If you want me to do it from Rochester, February 3rd, get tickets at watplive.com. But if you can't come, send me a cameo request and I'll, get some celebrity to do it with me. Z-list celebrity, but a celebrity nonetheless.
Have I made it to Z-list celebrity yet? Do you think?
No.
Yeah. Double A.
Me
maybe.
neither.
Maybe a double A. Maybe I'm a double A.
Well, like a Z and double A. Yeah, on that we might be triple A.
Okay, yeah, that's close enough.
Yeah.
That's good for me.
If Pete, okay, so here's the difference or the distance. Our friend who was on our Patreon with us, Pete Davidson, he's probably our most famous friend. The difference between him and us is like Michael Jordan to basically me playing basketball.
Either one of us, or both of us together.
It's kind of
the
the scale is about the same too.
Yeah,
so there you
agreed.
go. Anyway, all right. Okay, that's it.
Cool, man.
That went by fast. For me, maybe not for people listening, but it certainly did for me. Are we going to play some? If you'll leave your mic on, he's going to use it for his mandolin.
Do a cameo.
Oh yeah. Oh, let's do the cameo. Let's do the cameo right now. All right, you ready?
Yep.
So if you all can hang in there, maybe the if the waiting room would all put let me see
The
what
Fluid
her name is.
family.
Yeah, if the Fluid family would all type, what's her name? Sue. Say, hey, Sue, you're a good one or something like that. I'll try to get it on there if you guys don't mind having your name on there. Because what it is it says, hey, Dr. Steve, my mom came down from Illinois to help me with my initial chemo treatment. She's really impressed with how you're my go-to friend for the whatever he's got. Her question is, where's the final resting ground for amputated toes, organs, and excised body parts? Oh, that's a good question. Yeah, how are they disposing of? I know how they used to dispose of them. How are
Incinerate, don't they?
surgical? Yeah, that's what I was thinking. Samples disposed of. We could ask the AI that too. Yeah, just incineration or autoclaving. Huh.
Autoclave. That sounds weird.
Now, they don't discard them right away. They'll hang on to them. But like if you had, say, a giant lymph node removed or something like that, they'll leave them in jars.
I like to age them.
Yeah.
Age to perfection.
Let's see. Okay, federal law called CLIA guides regulation. To be CLIA regulated, labs must keep human specimens for a minimum amount of time. Cytology slides are 5 years. Paraffin blocks for 2 years. But it doesn't say anything about big like legs and stuff. Right, let me look. Anybody out there know?
No.
Okay, yeah, say there you go. I like that. See?
Yes.
Ivers Keller said, hey, Sue, you're a good and good. There you go.
Yes.
How long do they keep amputated legs? How about that?
See, Dave. Have a good.
Who's leaving?
Dave Hayes.
Dave's leaving?
He said, thank yous.
Well, shit on you, Dave.
Shit onions.
Maybe he doesn't want his name on there.
Dave, code name.
Oh, here, she took her amputated leg home, and you can too. Huh, who would want to do that? Oh, she got it back in a plastic bag.
Made a
What'd
lamp
you do
out
with
of
it?
it.
Bury it?
Probably made a lamp out
maybe.
of it.
Stupid.
It's fragile. Fragile.
Okay, keeping your own body part isn't inherently any more dangerous than keeping a steak. Well, okay. Huh. Nipples for sale. You're considered the owner of the body parts as long as they're inside of you. Once it's taken out, we have some reasonable expectation about what's going to be done with it. Because I know I've had people want their gallstones and they won't give them to them.
Mm-hmm. It's amazing.
Yeah, okay. All right. I think I can answer that one a little bit. I'm not authoritative on it. You ready?
Yeah.
Okay, here we go. Hey, Sue, it's your old pal, Dr. Steve from Weird Medicine. And this is a cameo to you from your son, Clinton, who I've become intimately involved in, but not like that, Sue. I know you were thinking that, but anyway, no, she wasn't thinking that. We're in the Weird Medicine studio.
Hello.
And there
What's
is
up?
Stacy,
Hey, Sue.
and there's
What's
Dr.
up,
Scott.
Sue?
And we all wanted to say you're a good one for coming down and helping Clint. I hear you came down from Illinois, and I spent some time in Illinois myself in Elmhurst. And all of the people in the waiting room, I don't know if you can see that, but they're all saying, "Hey, Sue, you're amazing. Hey, Sue, you're a good one. Hey, Sue, much love from the Fluid family." That's what our listeners have just decided that they're going to call themselves. So anyway, your question, however, was if someone has something that's amputated, like toes, organs, or excised body parts, what happens to them? Well, there are some rules about specimens for laboratory analysis. For example, if somebody looks at something under the microscope, then there are rules called CLIA rules. And what the CLIA is Clinical Laboratory Improvement Amendments. And cytology slides, you have to keep for 5 years. Histopathology slides, let's just say that you had a lymph node removed and they sliced it up and looked at it under the microscope, would be 10 years. And if they do a paraffin block, which they often will, to facilitate slicing something, like if you've got a lymph node and it's kind of juicy, you put it in a paraffin block, and then you can slice that paraffin block, and you can get much thinner, more even slices instead of trying to slice something that's
soft.
Soft, yeah.
Gelatinous.
Those are at least 2 years. And then if you're talking about a leg or something like that, you can actually ask to keep it, and the doctor will tell you it's illegal, and it may not be, but you may have to get your attorney involved if you really want it. I have had people say, well, if they take my leg off, how's the good Lord going to put me back together in the resurrection? It's like, he'll figure it out. Don't put limitations on him like that. He can work around a leg. Anyway, thanks, Sue. Thanks for taking care of Clint. Tell Candace we said hello, your lovely daughter-in-law, and you're an awesome mom. And if there's anything we can do for you, let us know. So,
see ya.
Goodbye.
From the Weird Medicine.
Take care.
Oh, shit.
Fluid.
This fucking phone. Look at that.
Oh, no.
We're going to have to do that over again. It just reset on its own for no reason.
Oh, jeez.
God damn it.
Did it save it all?
Sorry. No, I don't know. I doubt it. Here. Oh, listen. Here. Oh, hello, Moto. Go fuck yourself. Don't ever buy this particular phone.
Agreed.
I'm going today to do this. That's the last straw. Sorry, everybody. Now we got to do it over again. Probably.
Oh no.
I'm going to go look and see if it's saved. But Cameo is a really sort of rudimentary, shitty app, and I'm going to bet that it didn't.
I sound like I have a wad of cotton in my mouth.
Nope. Here it is. Let's do it all over again.
Oh, for fuck's sakes.
Yep. Okay. Sorry. Well, okay. That was our rehearsal. Here we go. God. Take 2. Hey, Sue. It's your old pal, Dr. Steve from Weird Medicine. I'm here in the Weird Medicine studio. There's my wife, Tacey.
Hello.
There's my partner, Dr. Scott.
Hey.
And this is a cameo to you from your son, Clinton. And I understand that you come down to give him a hand, and hope that things are going well. We really appreciate you doing that. As a matter of fact, everyone in the waiting room here has said, I don't know if you can see them or not, but are saying, hey, Sue, you're a good one, Sue. There's that one. Let me see what else. Sue, here's some good medicine from a weird bunch.
Yep, that's accurate.
Yep, and anyway, and that, and Inboxer says to your question, he's got an answer for your question. We'll get to that in a second. So your question was, where is the final resting ground for amputated toes, organs, and excised body parts? Well, there is a federal law called CLIA, which stands for Clinical Laboratory Improvement Amendment, and that guides the regulation for certification for clinical labs, and they have some rules about this. If you have a cytology slide, they'll have to keep it for at least 5 years. Now, that's basically where you just have a smear, a blood smear. Then histopathology slides, that's when they look, say, a frozen section, of some cancerous tissue or something like that, then they got to keep that for 10 years. But sometimes they have to do a thing called a paraffin block. So if you've got a lymph node, for example, that's been removed, they will put it in a wax cube, and it's easier to slice across that whole thing and get a nice thin slice. They got to keep those for 2 years. Now, if it comes to feet and legs and things like that, your doctor will tell you can't have it. It's illegal for me to give it to you, but it's actually may not be true, and it may be state dependent. And we were just looking at a story of a lady that wanted her leg after her surgery, and really it's no more dangerous unless there's an infectious disease in it than keeping just regular meat, although I don't know why you'd want to do that. But anyway, so we appreciate you taking care of our buddy Clint. Please give our best to your lovely daughter-in-law, Candace, and you surely are a good one in our book for coming down from Illinois. I spent some time in Illinois myself in Elmhurst area for taking care of your son. So and give him our best too. Thanks, and thanks for listening, and yeah, have a great weekend. All right, now you're good. Taste.
See, taste.
All right. Damn it.
I hope Liam finds a way home. I don't want to go to Johnson City.
You don't? Well, I can just go. I can Uber over there, and then he can. That doesn't even make sense, does it? I can Uber home. They can't.
I'll go with you.
Well, okay. We just said you don't want a car.
Oh goodness.
So it's supply chain problem.
Oh,
they
yeah.
can't get a post for his car's battery attachment.
Oh no.
And it's just holding up everything.
Ew.
So they had to give me a loaner today. You know they're not making any money.
No, hell no.
So
that's terrible.
All right. Are we going to play what we were going to
Yeah,
play
let's
on
do-
Harrison
let's-
Young?
yeah, let's do Make It a
God,
Ballad.
I had so much fun on that show. He's going to have us back, I think.
Yeah, I really, believe me, really wish I'd have been
It was, well, it's cable access, but he is such a different kind of dude that I was really glad to have done it.
Cool.
Now, I was the first to go on Cardiff Electric show, and so Carl was the first to go on Harrison's show. So we're always breaking the ice on these things, and then the rest of the, that sort of universe ends up on their shows until they get bored with us.
Good stuff.
All right, what are we doing?
Well, let's do Make Me a Palette in
Okay.
G.
All right, you got it.
And we won't do it in breakneck speed.
No, well, I don't care if we do.
Let me get a little action here.
Now, people who were here last weekend, if you don't see our YouTube channel, at the very end of the show, we were struggling to try to do Rocket Man. And I got so frustrated, we just played a song that we knew and then stopped. But Scott and I practiced it. And I'm not saying we did it well, but we did it well enough that we put it up on YouTube. So it's on our YouTube channel.
I listened to it again. It wasn't the worst thing we've done.
No, not the worst thing we've done.
I don't think you'll ever hear me say we did good.
But we could do it. Listen, if we got a fiddler up here and a banjo player up here, we could do some stuff like that. Especially if they can sing.
Yeah, exactly.
We'll get Mike Milhorn up here with his guitar, too. What are you playing?
G, make me a palette. G, make me a palette. G, make me out a palette. Make me a palette on your D, D7. G, 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 A, D,
wait a minute,
F sharp minor, G, D, G, A, D, D7. There you go. G, G, D, D, G, D, A, D.
Why am I having so much trouble with this? Hang on a second.
That
used
was
to play this differently.
Not close.
Oh. Okay. I see what I'm doing wrong.
Let me forward it to you. You got it?
No, I got it.
Because it just repeats over and over.
Yeah, I got it.
So I'll play again. A D F sharp 7 G D G A D. Make me down the pallet on your floor. Make me down the pallet on your floor. Honey, won't you make it down, make it soft and low, somewhere where my good gal she won't go. I'm going up the country through the sleet and snow. I'm going up the country through the sleet and snow. Honey, going up the country through that sleet and snow. Ain't no telling just how far I might go. I get my breakfast here and my dinner in Tennessee. I get my breakfast here and my dinner in Tennessee. Honey, I get my breakfast here and my dinner in Tennessee. Don't just come and say you better look for me. So make me down a pallet on your floor. Make me down a pallet on your floor. Honey, won't you make it down, make it soft and low, somewhere where my good guess she won't go. Now you know I can't lay it across your pretty bed. You know I can't lay it across your pretty bed. Honey, you know I can't lay down across your pretty bed. My girl will shoot and kill me dead. So make me down the pallet on your floor. Make me down the pallet on your floor. Honey, won't you make it down, make it soft and low, somewhere where my good gal she won't go. Now don't you let my good gal catch me here. Don't you let my good gal catch me here. Honey, don't you let my good gal catch me here. She punches your kick me, then she bite me on my ear. So make me down a pallet on your floor. Make me down a pallet on your floor. Honey, make it over by the door. That way then your husband, he won't know.
Are we miking the thing?
Yep.
I didn't
Yep.
think we were.
Sorry, buddy.
Oh, that sounds good, yeah. There you go. Try that now.
So make me down the pallet on your floor. That sounds better. Make me down the pallet on your floor. Honey, once you make it down, make it soft and low, somewhere where my good girl she won't go. Now you know I can't lay it across your pretty bed. You know I can't lay it across your pretty bed. Now, honey, I can't lay down across your pretty bed. My good woman, she'll shoot and kill me dead. Now, don't let my good girl catch me here. Don't you let my good gal catch me here. Honey, don't you let my good gal catch me here. She bite me and she wants to kick me in my ear. So make me down the pallet on your floor. Make me down, pallet on your floor. Honey, make it over by the door. Your honey don't come around me anymore. There you go.
There you go. Hey,
Sorry about that. I got a little.
I like the way you ended that.
Oh, I love it.
Yeah, if you go to the instrumental part at
Yeah.
the end, then I know you're going to end it. That's perfect.
It's better than me just going.
Yeah.
Thanks, Dr. Steve. Sorry to stop you. Yeah, I just I'll get this darn thing. Let's see. Clint from Illinois. He said he's been in the show. He's been here before.
Is that the Clint I just did the cameo for?
I don't.
His mom's from Illinois. He's from Florida, though.
Yeah, I think now this one. He said he's
Different
actually
Clint?
been on the show before. Yeah.
Okay.
Not bad, huh?
We have 2 or 3. Yeah, it's bad. Don't, when you start saying that, then it's. Then
Well, not bad. I mean, no, it wasn't good. Just not awful. No, you know, I was working on earlier. I heard on the way over here was we did it years ago with Jerry Jeff Walker, L.A. Freeway.
Okay.
Remember that?
No.
It's in G.
Are we gonna do it?
It's GCD. The only weird thing is the it goes to an A minor and A minor, and the chorus.
Okay.
Jerry Jeff Walker
Goes to A minor, A minor. That doesn't sound right.
E minor, E minor.
Oh, A minor, E minor.
Yeah.
Okay.
It's in G. L.A. Freeway, guys. Y'all heard it before. Yeah, no, Sean. If we had a washboard and a banjo picker, now we'd be rocking and rolling.
Well, if we had a washboard, we could do some dang Cajun music.
We could. Oh yeah. This
I
is
still want to do "The Back Door" by D.L. Menard. Okay, what are we doing?
Give me just a little bit of volume, please.
Is that thing even in tune, though?
Pack up all your dishes. Make note of all good wishes. Say goodbye to the landlord for me. Son of a bitch, he's always bored me. Throw out those old LA papers, the molded box of manila wafers. Adios to all this concrete. I'm gonna get some dirt road back street. 3, 4. If I could just get off of this LA freeway without getting killed or caught. Down the road in a cloud of smoke to some land that I ain't bought. If I could just get off of this LA freeway without getting killed or caught.
That it? It goes to the
Yeah.
D then.
Yep.
It's
Yeah,
not just A minor, E minor. God damn it. Okay, I can play that. Can you not play that on the mandolin though? That guitar sounds terrible.
Sure, yeah.
I
Yeah,
just
just turn. Yeah, make sure you kill the volume with it.
Okay, I will.
Yeah, no.
Yep. I mean, you got that. Is that the Ratliff mandolin you got?
Oh
there?
gosh, yeah. Lord, yeah.
Well,
I think I'm good.
just play
I'm
that
good.
instead of that peavy guitar.
I'm good. I'll bring my Taylor over here one of these days. Well, we got it. We have a good guitar down there.
Yeah, I have a
Let's
good
bring-
guitar down
let's
there.
bring- So yeah, it's just the.
Yeah, I got it.
You got them?
I think so.
Yeah, I'm pretty sure you can't screw me up. It would take something pretty severe for you to screw up my singing. Back up all your dishes. Make note of all good wishes. Say goodbye to the landlord for me. Son of a bitch has always bored me. Throw out those LA papers, a molded box of vanilla wafers. Adios to all this concrete. Gonna get some dirt road back street. If I can just get out of this LA
Okay, I see.
freeway.
All right,
Yeah.
one more time.
Yeah,
Okay,
sorry.
now
Yeah.
okay, so we're going to the chorus there.
We'll go.
Okay.
Hang on.
All right, I got it.
Adios.
No, I got it.
Gonna get some dirt road back street. If I can just get out of this LA freeway without getting killed or caught. Down the road in the cloud of smoke to some land that I ain't bought. If I can just get off of this LA freeway without getting killed or caught. A minor, resolved to D.
Start over. No,
Yep.
wait a minute.
Yep.
So it does the C,
Yep.
D,
Yep.
G,
Yep.
C.
Yep.
Then where does it go?
G.
Wait, what?
E, G, back to G, and then E minor.
Okay, so it goes to the G.
Yeah.
So let's
Yeah.
do that
Yeah.
one time real quick, and then I've got
Yeah,
this.
so we'll do the course. So
Yeah,
we'll
just
go to
do
the course. Yeah.
2,
Going to C. If I can just get off of that LA freeway without getting killed or caught. Back to G. Down the road in an E minor to an A minor to a D. Bot, and I see you just get off of this LA freeway without getting killed or caught. And then C, and then it's just the interlude again. And then back to G. Back to G in an E minor.
Yeah.
A minor. And then let the D ring. And then you'll walk it back to the G. Here's to you.
Okay, got it.
Yeah.
All right.
Perfect.
You ready?
Yep, I'm ready. Yeah, Colin Carnes is making fun of my PV guitar.
That's my PV guitar. No,
Exactly.
It's not his fault. Okay.
Yeah, hey, love it. I'm glad you like this song. I love Jerry Jeff Walker.
All right.
And I heard this on the road come over. It was on Sirius Outlaw Country. Yeah. So
we can play anything. It's
yeah,
on
we
there.
can play it.
Right.
We can play anything poorly. So
No, I mean, I would be okay if we played anything on it. I'm not saying we could play it.
So what I'll do is I'll just watch you when you go to transition that next note on the intro. It's so
Yeah.
pack up all your dishes.
Okay. Are you ready? We're
Yeah.
gonna record.
Yep.
Okay, you ready?
Yep. 3, 2, 1, and pack up all your dishes. Make note of all good wishes. Say goodbye to the landlord for me. Son of a bitch has always bored me. Throw out those old LA papers, that molded box of vanilla wafers. Adios to all this concrete. Gonna get some dirt road back street. If I just get off of this LA freeway without getting killed or caught. Down the road in a cloud of smoke to some land that I ain't bought. If I could just get off of this LA freeway without getting killed or caught. Here's to you, old skinny Dennis. Only one I think I will miss. I can hear that old bass singing, sweet and low like the gift you're bringing. Play it for me one more time now. Gotta give it all we can now. I believe every word you're saying. Gotta keep on playing. If I can just get off of this LA freeway without getting killed or caught. Down the road in a cloud of smoke to some land that I ain't bought. If I could just get off of this LA freeway without getting killed or caught. pink slip in the mailbox. Leave the key in the old front door lock. They'll find it likely as not, with all the other shit we forgot. Oh, my lady, don't you cry now. Love's a gift that's truly handmade. We've got something to believe in. Now I believe it's time we're leaving. If I can just get off of this LA freeway without getting killed or caught, I'd be down the road in a cloud of smoke in some land that I ain't bought. If I could just get off of this LA freeway without getting killed or caught, down the road in a cloud of smoke to some land that I ain't bought. If I could just get off of this LA freeway without getting killed or caught. There you go. Good job, Dr. Steve.
No.
That was good.
That's a good song, though.
You sound good.
It sounds like a dang Parrothead song, though, but it does, doesn't it?
Well, it sounds like kind of a parody, kind of, what's his face?
Because I'm
John Pine,
eating cheeseburgers here in
Paradise with all my rowdy friends tonight. We'll make a mashup. Hank Williams Jr. and doing margarita shots in the morning, eating cheeseburgers in the afternoon, listening to Weird Medicine with all my fluid family.
All right, anyway.
All right, boys and girls, I got to go for a stroll. I'm taking my pups to the mountain for a stroll.
Oh, are you?
Yeah.
Oh, shit.
I promised them before I left them. Hey, thanks, guys. Thanks, Colin.
Yeah, it was fun.
Yeah, that was a good one. That's a good one. I think we are grateful that you guys stick around and
Leg cramp.
enjoy the fun. Hope you guys all have a wonderful rest of your week. We do love our fluid family. That way, in case anybody's taking shots.
Hey, does anybody have any question while Scott's going for
Thanks,
the AI?
guys, so much. Thank you so much.
I'll hang around for a second and see if you guys have any questions for the AI.
Oh, man. Don't forget your nasal spray, Dr. Steve.
Oh, yeah, no, I won't.
Get
Thank you. I feel better already.
Good for you. Good stuff. Thanks, CC. See you, Sean. See you. Love it. And tell Kush when he gets in, he's late. Hope Kush is all right. He wasn't there today.
No.
Oh, man.
All right.
Yeah,
Well,
I
thanks,
appreciate
buddy.
you, man.
Yep.
Thank you. Yeah, I hate to leave you, but I'm going up on Bays Mountain for a stroll.
Are you? Okay. Well, that sounds like fun. Isn't it?
It's cold, but it's when you walk far enough, it ain't too bad.
Well, this guy says that hearing just do the music makes him miss with G-Back. Us too.
Oh,
That's
well,
why we're doing it.
That's why we're doing it.
It's the only reason we're doing it.
And believe me, if he were still here, the music would be much better.
Yeah, and that's true. If he were still here, the music would be 1,000 times better.
1,000 times better.
But Scott may not have ever had any reason to actually learn how to sing. We still need to play that. Let's redo the Sweet Melissa maybe this week if you've got time. When's Robin going out of town? Anyway, well, I mean, she's out of town every other week, so when she is, come over here. We'll record that. I've got the track that we did before. You just redo the vocals, and then we're going to play them A/B, just to show how the difference.
I know. I'm with you. The other thing we need to do again, not as our last song, but is just a tribute song. We'll do
Blue Eyes.
Blue Eyes.
Yeah.
If we can do it without crying.
I can do it without crying now.
Yeah.
I couldn't then, but I can now. Okay, man.
Hey, I'll talk to you later.
All right. Thanks.
Hey, have a good night.
Okay, you too. All right. Okay. Anybody have any questions? I have a paid for AI, not just Chat GPT, and I actually used it for work the other day. Not anything clinical, because I wouldn't trust it for that yet. But I needed some statistical analysis done. I had to figure out what a sample size would be for us to show a statistically significant difference. And it walked me through the whole process. It was great. It saved me at least an hour. So let's see here. Well, Carla, yeah, you don't have to call in. You can do it here, and you can ask them, or you can call them. It's more fun if you call in, but you don't have to call in to ask penis questions. Let me see if anybody else got any comments moderated. I saw, okay, it's all Carla. Okay, hang on. You got moderated by the Google algorithm a bunch of times. Okay, there you go. I just released all your comments. Yeah, I'm still playing with the Moog. Let me see. Matter of fact, here you go. No, that's not a Moog, but it is a Novation synthesizer, man. All right, no questions for the AI, I guess. That's too bad. Anything. Apparently this thing will take voice commands too, but it doesn't have any voice input on this computer, so. Let's see. Tell me a story. Okay. About the Fluid family, who are listeners to Weird Medicine and hang out in the YouTube chat room. The main characters are Carla, Richard, also known as Kush. See what it does with that. Sean. Who else is in here? Patty. Clint. Ivers. That's all I see in there right now. So, and Amanda, of course. And they are all in love with Amanda, who always spurns their advances. Make it 100 words or less, and make it funny and rhyming. Oh, you can do it. Okay, let's see. Please. Please. Okay. And this is the general AI. See, I haven't trained a new personality. Let me see. Oh, there's a poet, though. Okay, let's do the poet one. Oh, okay. Okay, if you use and then it doesn't know what weird medicine is if I use the poet. So we'll just see how it does. Okay, here we go. Oh my goodness. Okay, let me see if I can get it to. Okay, let me see if I can get it to. Here you go. Hang on.
Once upon a time there was a fluid family who adored Amanda. But she showed no amity. Carla, Richard, or Cush, Sean, and Patty, and Clint Ivers all had hot flushes so saucy they loved to listen to Weird Medicine.
Okay.
But Amanda never showed any compliance, although they tried hard to win her heart. She refused them. Right from the start they were sad, and vowed never to give up. But Amanda had already said, enough.
Okay. I would have had it read it a little bit differently. Once upon a time, there was a fluid family who adored Amanda, but she showed no amity. Carla, Richard, or Cush, Sean and Patty, and Clint and Ivers all had hot flushes, so saucy they loved to listen to Weird Medicine, but Amanda never showed any compliance. Though they tried to win her heart, she refused them right from the start. They were sad and vowed never to give up, but Amanda had already said, enough. That was pretty clever. Yeah, Carla, there is a medical condition where a man can't orgasm every time. Okay, let's ask. I don't know if the AI, it's supposed to not respond to inappropriate requests, but I think a medical request is perfectly acceptable. Let's see what it says. It's just called a delayed ejaculation. Let me see what they say. Oh, yeah, well, okay, and it got one of these questions right, to anorgasmia, but mostly that's in females, but it can occur in men, too.
Yes. There is a medical condition called anorgasmia which affects men and can cause them to have difficulty reaching orgasm during sex, oral, or manual stimulation. Anorgasmia can be caused by a variety of factors such as medications, alcohol use, diuretics, high blood pressure, and sexual anxiety. If you are experiencing difficulty reaching orgasm during sex or other sexual activities, it is best to consult your doctor who can provide advice and treatment options.
Well, thanks, Carla. Now the AI thinks I have a problem in the bedroom. There you go. Any other questions for the AI? You want me to tell it that? Okay, I'm going to tell it. In your poem above, something you couldn't know, Amanda would never say enough. Can you rewrite it? Oh. With that in mind. Okay. Let's see what she says now. Oh, it's completely different. Oh, no. Well, okay, it didn't understand me. Okay, you didn't say enough. You said enough is enough. Once upon a time, there was a fluid family who adored Amanda, but she seemed so aloof. Carla, Richard, Sean and Patty, Clint and Ivers all had hot flushes so saucy they loved to listen to Weird Medicine, but Amanda never showed any compliance, although they tried to win her heart. She refused them and refused to take part. They were sad and vowed to never give up, but Amanda had already said enough is enough. So what she's saying is, I already said that she said enough, so you can't change it. I'm going to take it that way. Oh, yeah. All right, what causes neurofibromas? Usually caused by a genetic disorder called neurofibromatosis type 1. Or, well, okay, you can have them without them. But this is caused by mutations in a gene that controls production of a protein called neurofibromin. This gene is believed to function as a tumor suppressor, meaning that NF1 is caused by lack of this gene's function. Solitary, which is what you're talking about, neurofibromas, can also occur in people who don't have neurofibromatosis. Okay, well, I'll give you that. Okay.
Give yourself a bill.
The cause is not known, although researchers are exploring the role of trauma. That's pretty interesting. Now, I have seen people who had excisions form a very tender area in the scar tissue, and if you touch it, they'll jump, and it's little peripheral nerve fibers that are sticking up in the scar, and I've resolved those before by just numbing them up and re-excising that and sewing it up again. So, okay, let me see. Unexpected death rate. Are you talking about from COVID? What was the excess death rate? Is that what you're talking about? During COVID-19. Now here we go. From 2020 to through 2022. Oh, I gotcha. Yeah, Inboxter. That's really a good question. And there were, they're saying here there are 14.83 million excess deaths globally. 2.74 times more deaths than the 5.42 million reported due to COVID-19 for the same period. And a lot of that, I think, well, some of it came from lack of health care because people were too scared to leave their homes because of lockdowns and mandates and stuff, so they didn't get colonoscopies, mammograms, stuff like that. And then there was some problems with access to health care for people who had non-COVID illnesses. Let's ask it what it thinks the causes were. Are the non-COVID reasons for these excess deaths? And the thing that pisses me off about insurance companies is, yeah, okay, they want to recoup their losses over COVID, so they're going to jack up are they ever going to go back down again? When the excess deaths go back to normal, will those rates go back down? Hell no. If they will, then okay, maybe we could talk about it, but it's just like taxes. They add these taxes, I never see them go back down again. But what are the non-COVID reasons for these excess deaths? Let's see where we go. Get from that. Okay, deaths from other infectious diseases such as influenza that went undetected or untreated. That would support my hypothesis. Delays in seeking and receiving treatment for other see, all that's gone due to limited healthcare resources. Wow, it sounds like it was listening to me. And increases in mortality from some non-communicable diseases due to disruptions in the delivery of preventative and curative services. In some countries, the excess mortality is likely to be due to a combination of these causes. So. All right. I got to get this Gino Bisconti interview edited, or I'm never going to get it up, and this is my one time to do it. So I enjoyed hanging out with you guys. Yes, I have seen Inboxer. I have seen that. One of my concerns about it is it, and this is no flies on my brothers and sisters out there who are funeral directors, but they're not medical professionals, and I want to see pathologists weigh in on this. And I have one of our frequent guests on this show is Chanda. She has another name, but it doesn't matter. It's inappropriate. And she is a funeral director now, or she's going through funeral director school. And I've tasked her to find out what they're saying about that in funeral director school. So I'll let you know as soon as I know something. But I've talked to pathologists about that. They're not seeing it when they're doing autopsies, but then the funeral directors drain the whole body of fluid. The pathologists don't. So if there is a signal there, they should pick up on that, and we'll figure it out. We do know that COVID and the vaccine both can induce inflammation in blood vessels, and that certainly makes sense. People who died from COVID would have intense inflammation in their blood vessels sometimes and may develop these fibrous clot things. So, I'm not saying it's horseshit. I've just not seen the science behind it yet. 100 funeral directors saying this is 100 anecdotal bits of evidence, but we don't discount anecdotal evidence fully until we've investigated whether there's science behind it. So that's where we are right now with that. But thank you for bringing that up. All right. All right. Hey, thanks. That was fun hanging out after Scott and Tacey left. All right. See ya.